Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything's magnified a bunch, maybe 40 times on the screen. So you see a gray cannula coming in the front of the shoulder. Here's your biceps tendon on the left. This is the biceps anchor. You can see you've got some tearing there. So this is what's often called a slap lesion. There's different types of slap lesions. This would be more of a degenerative type of a slap lesion, in my opinion. But they can sometimes cause symptoms. So we're going to go ahead and use a shaver just a little bit to clean up the area while we're getting a stitch ready to do the biceps tenodesis. Go ahead and lock me down there. Lock me down. Sorry? Okay, so our shaver has some suction attached to it. So there's a pretty good picture here. See how that's kind of an area where there's been some tearing. The rotator cuff tear is over here to the left. This is the hole in the rotator cuff tendon right here. Luckily, it's not that large of a tear in that it doesn't retract past the glenoid, but it's certainly a full thickness tear right there. Okay? We'll get a better look at that in a minute. Hold the camera, please. Okay, so now we're going to pass the needle right through. So we're passing right through the tendon there. We're not trying to get any of the plastic on the cannula, so we'll stop short of that. That wire that you see is called a super shuttle. We're going to reach in with a grasping type instrument just to grab the wire here. We'll back the needle out, pull the wire into this great cannula. Now the trick here is outside your shoulder. We're going to load that super shuttle with a white stitch. As we pull back, you'll see that come through. There it is there. And so that gives us our first pass through the biceps tendon. We're going to do it one more time. And I'm going to come a little bit more lateral, or anterior rather. Right next to his spine. That looks like a pretty good spot. Outside the skin, we're separated by about 1.5 inches, maybe 2 inches. Here we're going to feed this super shuttle relay through again. There it is. And now we're going to do a little extra step here to make our stitch a little bit stronger. So we're going to grab it like that. And now here's the extra step. We're going to sneak around behind the biceps tendon like that and retrieve it out this way. You'll see why we do this in just a minute. It gives us a loop of suture that goes around the biceps so that when we pull on that loop of suture or secure it, it actually gives us a much stronger hold on the biceps. Okay, so see now that suture is going all the way around the backside. See that? And so that's very strong because now when I pull on that, it grasps the entire tendon. See that? So I'm happy with that. So now we're going to take a pair of scissors. We're going to cut the biceps tendon at its base here. Okay, and so now that biceps can't bother you anymore inside the joint because we've released it. So we can still see some of the other anatomy here and have a look around. This is part of the middle glenohumeral ligament. See this wispy attachment here. This is the subscapularis tendon here, crossing it. Hold the camera. An idea of the caliber of this middle glenohumeral ligament. You can see my spinal needle here. Okay. This is an 18 gauge spinal, and that ligament's about the width of the bevel of that needle. So it's pretty thin, not really a way to inject it. If there isn't much arthritis in the joint, that's good. These articular surfaces look pretty smooth. Here's the back of the shoulder, looks pretty good. And then as we slowly come back around, we'll get up to where the rotator cuff's torn, which is right there. So we're going to switch positions with your shoulder and get to work on the rotator cuff and the other things in the subacromial space. Okay, so we're using this device. Push down with that, so you're exactly the opposite way. So we're just in the subacromial space. The scope, or the camera's coming in from the back. This gray cannula is coming in the front. This instrument you see here on the right is coming in from the lateral side of your shoulder. And we're just removing soft tissue so that we can expose the bone. So this instrument doesn't remove any bone, it just removes soft tissue, synovial tissue basically, from underneath the acromion at this point. We're underneath the acromion. And we're just going to remove some of this bursal tissue so that we can see and have access to the acromion in case we need to remove any bone. Okay, so here's the hole in the tendon. We've been working on it. As we look back here, we can see it extends back a little bit more posterior than you would first guess just looking down at it. So we're going to start by placing our first suture anchor posterior right about here. This may be one of those tears where we need 1.5 anchors, but we'll decide that in a minute. So posteriors to the left, anteriors to the right, and the camera right now is coming in from lateral. Hold the camera there. Our needle that we use to check our angle of insertion. So we're going to place this first anchor back about here. We'll show you how we do that in a minute. We're going to first make a little nick in the skin. Here you can see the inserter. We're going to place this right where we want the implant to go. We're just confirming our positioning again. I think I like that. So here's the anchor in the bone. That's very solid. We're going to reach in from the front and take out one suture at a time here as we start to tie them. So we'll look down here. Looks like we want the solid blue suture first, so we'll take this one and we'll rotate. Hold the gray cannula, please. Stitch, basically just like that. Okay. There you can see the tip of the needle coming out there. There's our relay going into the gray cannula. Okay, so we're pulling back. Pressing. And now what you'll see is that that stitch is now coming underneath the cuff there, so there it is. So now we'll get the partner suture. We're going to tie this knot first because it'll give us a good posterior anchor point. We've got the first suture tied. You can see it right there. Now we're going to pass this black and white one. Turn to the right. We're going to use a slightly different angled suture hook in just a minute. This is the hook we're going to use this time. We call it a turn to the right. It's a 45-degree turn. And we kind of rehearse the stitch by looking at where we'd like the tip to end up, right about here, and then we dial it back. You can see the muscle tendon junction as we go more medial, which helps us also plan where to put the stitch. Okay, so there you can see the needle coming through and the relay, and we'll just reach in and grab the relay here. Hold the cane. Okay. Here's the second stitch. It runs basically like that. We'll tie these at the end because if I start tying these now or continue tying these, it's going to get really hard to see. So we're going to take those two out, side the cannula, and then we'll put the cannula back in like that. So now those sutures, see how they're outside? So now we can continue to work unimpeded here. And we don't want those sutures to ever get tangled or crossed, so that saves us a step. So now we're going to take the blue and white suture, hold it very cannula, and we're going to take a grasper here in just a second. Next stitch. Okay, so we've got those two sutures passed but not tied. You can see we still have a little bit of a gap here, and like I said, this is probably going to be a 1.5 anchor repair. Obviously we can't put in half an anchor, so we're going to get ready to place another anchor right about here. We'll pull the obturator and place the anchor there. And so this is where our next, I should say your next anchor is going to go, right about here. Here's your second anchor end. I think the last stitch we used here was blue and white, so we're not going to use that one. We'll go back to the solid blue. And we'll take this out the back this time. So there that goes. And now we're going to use a slightly different angled hook. This is going to come from the right side of the screen, which is anterior. Hold the camera there. Grasp it. So in order to use this turn to the left suture hook, we're going to pull out the anterior cannula because right now the hook won't go through that smaller gray cannula. So hold the camera right there, please. So here's the hook. Let's find our last stitch, which is right there. You can just see it right there going in. So we're going to move over just a little bit. I'd like to place one right about here. You can see the muscle tendon junction starting back in here. It's still tendon. It's going to be back a little bit more medial. So we have a little more space. Stitch. Planning the last stitch. You can see that one. We're going to move over here and place this last stitch right about here. So this is what we call a single row repair for reasons that you can guess because we're just passing these sutures along in a single row. There's double row repairs. There's even some reports of triple row repairs, but I think for what we're dealing with here, this ought to do well for you. So now what we're doing here is we're getting ready to tie all these sutures. So we're going to tie them one at a time from left to right on the screen, which is posterior to anterior. So you can see how they line up nicely for us. This is going to be the next one we tie here. So we're all done. Let me show you what we've done here. Here's the repair. That's the most posterior stitch, that solid blue one. Then we go black and white, then we go blue and white. So there's 3 sutures from the first anchor. There's 2 sutures from the second anchor, so that's what we call a 1.5 anchor repair because we didn't use all 3 sutures. Because as you see right next to that, we're out of the tear. It's already fully repaired. That white suture there is for the biceps. We did a soft tissue tenodesis. So that's been tied as well. And then as we rotate your shoulder, everything's moving together as a unit. That looks great. And now we're going to add our orthobiologic component to our repair by making some little holes in the bone here. So we're going to obviously stay out of the way of our anchors. We're going to tap that down. This goes into the marrow and allows us to take advantage of some of the stem cells and other growth factors and proteins that are in the bone marrow that will hopefully help in the healing response. Okay, and so as I turn the pressure down, you'll be able to see some of the yellow marrow elements start to come out. See that? See how they start to come out? And even around the anchor holes. So that all participates in the healing response. We're going to finish up here, get you back to the recovery room shortly. But hopefully that'll do the trick for you, okay? Good luck to you now. Bye-bye.